Every year, Concordia hosts the P3 Impact Award. We scour the world for the best and most innovative public-private partnerships in partnership with the University of Virginia Darden School of Business and the U.S. Department of State Office of Global Partnerships. We had our strategic dialogue this morning where we heard from all 5 of the nominated partnerships, and now it is time to announce a winner. So please welcome to make the announcement Tomas DeBas, Managing Director of the U.S. Department of State's Office of Global Partnerships. Tomas?
Thank you. Good afternoon. The U.S. Department of State's Office of Global Partnerships, Concordia, and University of Virginia's Darden School of Business, Institute for Business and Society are once again humbled by all the applicants to this year's P3 Impact Award, which recognizes leading public-private partnerships from around the world. The award was born from an aligned interests across all sectors, nonprofit, government, and business, and an ardent desire to better understand the growth of partnerships and the factors that influence success. Our mutual desires to understand the role of P3s in addressing complex global issues highlight best practices and shared learnings, as well as honor organizations leading the way has brought us here today, celebrating our 7th iteration in P3 Impact Award. To date, we have received hundreds of applications from all over the world, leveraging partnerships to address challenges in the local communities and countries. Each year, we are blown away by the applications we receive. They represent partnerships that are truly highlight cross-sector collaborations at its best. One that improve communities in the most impactful ways, fostering a more productive utilization of resources by respecting and leveraging differences. Public and private sector collaboration, embodied by partnerships like the ones we are celebrating here today, facilitates innovation and impact on scale that can bring economic security, peace, and prosperity to all nations. From embracing market-based solutions in agriculture in order to elevate farmers from poverty in Africa, to enhancing access to reliable, affordable, and effective healthcare in Eastern Europe, this year's finalists are driving the solutions that will create a more secure and stable global ecosystem. By using collaborative models and leveraging the strengths of public, private, and civil society partners, the finalists are ensuring the impact they're having today will continue to be sustainable and scalable for the next generation of leaders and innovators. They highlight the value of trust, transparency, and accountability in facilitating cross-sector partnerships that develop and deliver global solutions to some of our toughest issues. They are truly outstanding examples of best practices for working together across sectors to achieve shared goals. Congratulations to all of our finalists here today, and thank you for the positive impact you have around the world. Our 5 finalists are ASILI, Eastern Congo Initiative's social enterprise in the Democratic Republic of the Congo, the U.S. Agency for International Development, USAID, IDEO.org, Eastern Congo Initiative, and Allied aim to address the lack of quality healthcare, the scarcity of clean drinking water, and the shortage of meaningful economic opportunities in the Democratic Republic of Congo through a radically new solution based on market principles. By creating marketplaces with clusters of businesses in one location, ASILI not only generates demand for high-quality services, but also provides world-class, affordable supply in a scalable and sustainable manner. iBank of Ethiopia, elimination of corneal blindness partnership in Ethiopia. The Ethiopian Ministry of Health, iBank of Ethiopia, SightLife, and the Himalayan Cataract Project aim to establish the first iBank in sub-Saharan Africa to prove global best practices, ensure steady supply of tissue to the country, and drive cornea health system policy enablers, and serve as a model for development throughout Africa. Localizing development, IAF, MOT Public-Private Partnership in Mexico. The Inter-American Foundation and Charles Stewart Mott Foundation provide financial and technical support to local community foundations to help them establish themselves as source of the same support for cooperatives, associations, and other grassroots organizations. This support reinforces community-based institutions that understand the local context and mobilize assets for communities addressing their own development needs. State Affordable Medicines Program in Ukraine, committed to reducing the burden of preventable deaths with support from USAID through the SafeMade project led by Management Sciences for Health. The government of Ukraine launched the Affordable Medicine Program as a means to improve patients' access to patient medicines for Ukrainians. As of today, more than 6,000 pharmacies now offer reduced costs for their citizens. Last but not least, Wash Up Global. Through cross-sector collaboration, Sesame Street and World Vision work together to help improve children's knowledge and behavior around water, sanitation, and hygiene, or called WASH, by using play-based materials and content such as animations, storybooks, and games, featuring puppets like Raya, the partnership's global health ambassador. This partnership has been built on the tenet that school-based WASH interventions can generate broad public health benefits, as well as non-disease outcomes such as school attendance and gender equality. It has been another great year of strong applications, even stronger finalists. Each year, the P3 Impact Award process informs the partnering community about how different stakeholders are collectively working through internal and external challenges towards achieving the aligned goal. We learn so much through this process, use it in our own work towards strengthening the partnership ecosystem so that innovation in Eastern Congo, Ethiopia, Ukraine, and Mexico, and beyond could be shared with like-minded stakeholders around the world. I personally want to extend our sincere appreciation and congratulations to the partnership finalists this year today. Please join me in thanking the University of Virginia for their initial round of voting and for their leadership in this P3 Impact space. I also want to extend our gratitude to our esteemed panel of judges for the 2020 P3 Impact Award, Caroline Nabi, Tam Nguyen, Dr. Christopher Schwabe, Joanne Sonnenschein, and Dr. Dan Vermeer. So please join me for a round of applause for our finalists, UVA Darden, and the judging panel. The challenges facing our world are complex, in some cases entrenched. However, these partnerships demonstrate that advances in sustainable development, global health, and technical advancement are possible when public and private sector actors come together to advance shared goals. The U.S. Department of State is proud to partner with Concordia and UVS Darden School for Business to present this year's P3 Impact Award to a team who is truly showing leadership and delivering results. Please come to the stage. This year's P3 Impact Award winner is, from my country of origin, iBank of Ethiopia. Congratulations.
Well, thank you so much for this incredible honor. Thank you to P3 Concordia, the U.S. Department of State, and University of Virginia Darden School of Business, and all judges for this incredible honor. My name is Patrick Emery, a Vice President of India and Ethiopia at SightLife, the world's largest global health organization working to eliminate corneal blindness worldwide by 2040. Today, I'm so honored to represent this partnership that has transformed cornea care in Ethiopia, and which serves as a shining example of collaboration for scalability throughout sub-Saharan Africa. Before we focus on Ethiopia, I'd like to bring attention to the global burden of corneal blindness. More than 12.7 million people globally suffer from corneal blindness, making it one of the world's leading causes of avoidable blindness. But fortunately, there is hope. More than 80% of corneal blindness is treatable and preventable, and our partners take a health system approach to addressing this inequity that contributes to true corneal blindness worldwide, particularly in low and middle income countries. This health system approach applies best practices in clinical training, eye banking, prevention, public policy and advocacy, as well as access and innovation. Now, coming to the partnership that we're representing here today, more than 3% of the global blindness burden is in Ethiopia. But fortunately, 87 to 91% of blindness and low vision in Ethiopia is avoidable. Of avoidable blindness and low vision in Ethiopia, 7.5% is attributed to corneal opacities, for which corneal transplant remains the primary sight restoring procedure. And that is the focus of this partnership. Corneal transplant requires access to a trusted source of cornea tissue, which must be donated from a recently deceased individual, must meet quality standards, and be transplanted to recipient within days of donation. However, the global demand for cornea supply far outpaces corneal demand far outpaces supply, and a lack of affordable tissue in Ethiopia was the largest barrier to cornea care prior to the establishment of this partnership. With limited government support, minimal public awareness, no other functioning eye bank in sub-Saharan Africa, and a global cornea shortage, Ethiopia was ill-suited to develop the health system in ways that would meet the needs of the millions of corneal blind waiting in darkness. And with no solution in sight, NGO and government leaders in Ethiopia began discussing solutions. We knew the solution needed to be rooted in sustainability, particularly the UN Sustainability Development Goals of no poverty and good health and well-being. And growing local supply of high-quality cornea tissue in Ethiopia to overcome this largest barrier could not be accomplished without wide-ranging support. Thanks to close collaboration among NGOs and local leaders, it was determined the Eye Bank of Ethiopia, originally founded by Orbis International, could be scaled to meet national demand, could prove critical best practices in the region, and serve as a focal point for development across areas of the health system necessary for cornea health regionally. And the partners who came together to realize this dream included the Ethiopia Ministry of Health, which brought wide-ranging policy support to the most important policy underpinnings of the initiative. SightLife, the world's largest eye bank, brought technical expertise and sustainability consulting for eye banking, as well as a health system approach. Himalayan Cataract Project brought a vast training network to include short and long-term fellowships for Ethiopia cornea surgeons, which includes training on sight in Addis Ababa and collaborative trainings in the United States and Nepal, resulting in HCP training more than 50% of the corneal surgeons in the country. And the Eye Bank of Ethiopia brought connections across government, NGO, and community stakeholders, as well as a commitment to corneal blindness that ultimately resulted in such strong collaboration. As a result of this collaboration with local government, local media, hospitals, surgeons, celebrities, international NGOs, multinational corporations, the Eye Bank of Ethiopia Elimination of Corneal Blindness Partnership is able to meet 100% of the current demand for quality certified corneal tissue in Ethiopia, procured almost 4,000 corneas for transplant, received international quality certification in accordance with Eye Bank Association of America quality standards, and is poised to gain permanent sustainability funding by the Ethiopia Ministry of Health. Additionally, the Eye Bank of Ethiopia has proven the concept of broadening eye banking purview from traditional eye bank operations to becoming a catalyst for local eye care policy across the health system. As a result of coordinated partnership efforts, the first national donation policy has been established. The cultural concept of cadaveric donation has been embraced by the community, which is a first for sub-Saharan Africa. And the Ethiopia Ministry of Health has added cornea care to the national health policy. Eye banking has additionally been established as a sustainable profession in the country. The policy adoptions and steady supply of high-quality tissue by the Eye Bank of Ethiopia partnership has enabled the partnership to further expand scope to include clinical training capacity. The partnership has trained surgeons through our short and long-term fellowships. And to further bridge the gap, the partnership has provided cornea care, equipment, instruments, and consumables to surgeons nationally, all of which who rely on locally sourced tissue from the Eye Bank of Ethiopia. The need in Ethiopia is great. The need in sub-Saharan Africa is great. And the need in low and middle income countries globally is immense. But fortunately, the solutions exist. With your support, we together can eliminate corneal blindness worldwide by 2040. And I just want to thank all of you for the recognition of this support. It is so important for the future of eye care in Africa and around the world, and we're so grateful. Thank you.